Hi, this is Dr. Eric Westman with another edition of Ask Adapt for Adapt Your Life. The topic for today is pregnancy and the ketogenic diet. Well, in the medical world, there are very few topics as emotionally charged as pregnancy and having a baby, delivery. Obstetrics and gynecology, though, has known for a long time that if you have diabetes called gestational diabetes, diabetes during pregnancy, there's an increased risk for the baby. So when you step back and think about it, a keto diet is basically a diet that lowers the risk for gestational diabetes and lowers the contribution of food to raising the blood sugar. So OBGYN doctors have been prescribing low carb diets, not necessarily keto level low carb, but low carb diets for a long time, and have found beneficial effects with lowering the carbohydrate. That's why most women get a test at the beginning of pregnancy to see if you have gestational diabetes. But that said, there are not any research studies that I'm aware of that have a large sample of women doing a keto diet. So what we're left with is a growing number of anecdotes of people doing a keto diet during pregnancy. This puts us into that space of, yes, it's possible to do it and be healthy, or even Polly wrote in and said, I had the best pregnancy. The pregnancy wasn't, when she did keto during pregnancy, it wasn't as bad as the standard American diet pregnancies. She had no weight gain, she had no heartburn, and the baby came out fine. And as soon as she could, even after some nausea, she got back to carnivorous eating and had a much better experience than before. Another person wrote in that she did it and was fine. You can find an excellent review, an essay at dietdoctor.com on pregnancy with a growing number of people who are counseling women to do keto during pregnancy. And so we're in that space of you can do it, but the main question is, as Barbra asks, is this safe to do while pregnant? So it's harder to prove safety about a new drug, a new diet, or even about doing keto during pregnancy. If you think about it, if you do something once and it was safe, that doesn't tell you what happens if you do it 10 times or 100 times. So the larger number of people doing it safely increases your margin of error, or reduces your margin of error, but increases your idea of safety. So, this cries out for a survey or compilation of all of the people who have done keto during pregnancy. If I had 500 or even 100 women testimonials that they did the diet, here's what they ate. They had a normal baby, and then we queried the doctors to validate that information. This might be actually published in a journal. There was a similar paper done of a survey of type 1 diabetes and keto, which got published in the journal Pediatrics, actually. So Facebook surveys actually being published in medical journals. The reason I say it'll probably happen this way is it's difficult to get established researchers to be interested in doing such a study, although it's not unheard of, and I'm very happy to help collaborate with studies that would be done among pregnant women to do various types of diet, including a keto diet. There's another role for a keto diet in losing the weight after a pregnancy, and that might be where the research starts to show that it's fine for women after pregnancy, and then maybe it would be studied during pregnancy. Another question, how about breastfeeding and keto? And, so in my clinical experience, I've had several women do keto diets during pregnancy and while breastfeeding, and it seems to be just fine. But again, it's how many people do we need before we say that the margin of safety is a good one. So I certainly, when I step back and hear about populations on Earth that didn't have carbs and they were keto during pregnancy, and babies are born into ketosis and all the, I think there's kind of an irrational fear of using the term keto, and that actually bubbled up that you wouldn't want to tell your doctor you're doing keto. I found a smooth way to explain the diet is that you're doing a kind of modified Mediterranean diet, and then most doctors won't have a knee-jerk reaction against it. But interestingly, it seems that the breast milk may change. The composition may change if you're keto or if you're not keto, which again throws into the question of what's normal. If what we call normal breast milk is normal based on people who eat carbohydrates, and that may change. Most women have noticed that there's a higher fat content in the breast milk when they're doing keto and breastfeeding. Sue asks, are there any studies that have seen any benefits for the unborn child? And I'm not aware of any studies directly related to keto, but lowering the carbohydrates, especially if you had gestational diabetes, can improve the health of the unborn child, definitely. And then Tammy asked, do you suggest the typical keto program or a variation? Well, so I'm at that level of, I don't really suggest or recommend that you do a keto diet during pregnancy until there are more substantial and substantiated credible anecdotes and surveys of women doing it. Because when I give a recommendation, I need to have that level of certainty, ideally the level of certainty that would be required for drug approval, to know not only that it works, but that it's safe as well. So I can't quite sign off to recommend doing it. If you do want to do it, or you choose to do it, then find good resources to support you. And there's a great essay at dietdoctor.com to point you in those directions. Thanks for watching. Send your comments below. Click to subscribe so you don't miss out in future episodes. And I hope that's helpful.